next training is adjustment style, technique, and our vernacular when we're adjusting. And the CAs, the tech CA will be at the computers, and they will give some assistance to let you know how this patient's been adjusted before as far as style and technique. Also, something really, really important is they're going to be there to make sure that if there's any contraindications or red flags as far as things that we don't adjust or techniques that we don't use, they're going to make sure that you're well aware of that. They are found, alerts will pop up. You have ChiroTouch. Same way they would pop up for you when you first go to the computer. However, if a tech CA is there, she'll see them first. She'll use a sticky and put it on the computer screen or put it like right in front of you to let you know if there's certain things you do and or don't want to do. Otherwise, there's a red box off to the side that says contraindications. They'll also be listed there. So, adjusting style, a lot of what we do is mainly full spine diversified with a little bit of mirror image adjusting. We make use of the activator, flexion distraction, which we went through in a previous training video. So we're going to go through some of the vernacular and adjusting types. Number one is pelvis. So there's a couple different ways that we're going to adjust the pelvis. One is the drops, and that'll be listed as a drop, lumbopelvic drop. Number two is we do something called a side drop, and the side drop is essentially putting the patient on their side. So have you lay on this side, turn and face me this way. And as it sounds, it is a hybrid of a side posture and a drop. Okay. Patient goes on their side. Lumbar and or pelvic piece, either or both come up. And we do a gentle pressure down and we just adjust in, and the table will drop as we push down. Cheryl, let's have you lay on your back for me. We also have our straight side posture with I know you guys are familiar with that. Okay, from a perspective of thoracics, two basic ways from a manual perspective that we take them. One, we do anteriors. Okay, so sometimes I'll do a seated anterior. So Cheryl, let's have you sit up for me. Seated anterior. Sometimes people just move better, especially lower thoracics. It's just a fun technique I like to use. We bring the back of the table up. Patient tucks their chin down. We have them take a deep breath in, blow it all the way out, and we're going to gently sit them down with a gentle push. And usually anterior thoracics, I do them because people move a little better that way as compared to a straight anterior, which are laying flat, and or a P to A thoracic. Cheryl, let's have you lay back down. And cervicals, manual cervicals, we call it cervical diversified, because in chiropractic school many decades ago we said modified rotary brake, and I didn't want to use that terminology in front of patients. So our manual cervicals are cervical diversified. Okay, left, right. We do some toggle work with patients, and that'll be listed. It'll be like an atlas left or an atlas right from a toggle perspective. If you're not comfortable with the toggle work, that's absolutely fine. We will also do P to A drops. So have you turn over, lay face down again for me, Cheryl. So for the drop on the cervicals, if we're doing curve correction, which is a lot of what our practice does, headpiece. And Dr. Ritchie, if you're watching this, okay, you have these tables. Lift it up, gentle push down, table drops, and pretty simple right there. And again, going back to P to A thoracics, P to A thoracic. From a standpoint of extremities, we do some extremity work. If it's knees, we use the activator. Most often, I do activator challenges just to check there. We do extremities on ankles, feet, wrists, TMJ. So if you're comfortable with any of that, please feel free. If it's listed, the patient's had that before, or if they come in with a complaint, do your analysis and adjust how you're comfortable. Never do anything that you're not comfortable with just because we've done it before. Stay within your wheelhouse. What's most important is the subluxation gets corrected in a way that's comfortable for you and therefore best for the patient. Thank you.